Yes, sir.
Who actually wrote this health care bill?
Well, again, the House, I can't really speak for them, but it's going to be maybe the chairman and the three committees and pretty much their staff. With a lot of input from a lot of different people. On the Senate side, I'd say that's probably true as well. It was the members of the Senate Health Committee, and right now that's been an issue, is that they've not been able to write the finance bill because the members can't agree on what's in there. So they're working through that process, and like I said, the process is working. It takes a little time, and this is a very complicated problem with a very complicated solution, probably. I think what most people in Arkansas want, by the way, is they want us to try to fix health care and do it in a smart way, in a sensible way, but not break the bank in the process. I mean, I think that's what I hear over and over, maybe articulated in different ways, but that's what I hear when I travel the state. So to answer your question, it's written mostly by the members on those committees. The House, I think there's 3 committees, the Senate will have 2 committees, and it's still very much a working process. So, we don't know all the terms yet. Yes, sir.
What's your prognosis for cap and trade?
Well, cap and trade, my guess is will come after health care reform, assuming we can pass health care reform. You're talking about health care being complicated. Cap and trade is probably even more so. I would say that there's already a House bill on cap and trade that's come through their system. The Senate has not really started on a bill yet. I mean, in the Senate, under our rules, that bill has to go through 6 different committees. And I'm on the Commerce Committee, and we have a very small part of that. But Senator Lincoln, because she's on, she's on Finance, which will have a big piece of it. She's on the Ag Committee, which will have some of it. And she's on Energy, which will have a very big piece of it. She's going to, once again, she's just going to be neck deep, a very key player in this. So, if you're asking about the prognosis, whether it will pass or not, I think that is very much an unknown right now. I think that there are a lot of senators like me who have concerns about a cap and trade system. I do recognize that we have a problem, but how to fix it is where I'm trying to get to, and trying to get an understanding, and how to fix it in a way that makes sense for Arkansas and makes sense for the country. So that's going to be a tough fight as we go through that. But right now, that's just unclear. Yes, sir.
One of the major things that I'm concerned with is the statement, we want to reduce costs for medical care in the United States. It seems to me there's 3 things that really need to be addressed that really doesn't hurt the average citizen at all. One is fraud control,
yes,
particularly in Medicare, with some serious penalties for fraud, jail time particularly. Second is paying for the illegal aliens to have health care. They need to just go home. And the third one, that is tort reform. I mean, if you talk to a doctor and ask him what his major expense is, it's insurance.
Right. And
it's because of lawyers getting rich off of law. And tort reform needs to be addressed even better than it is. It's been addressed a little, but it really needs to be fixed.
Yeah, it has been addressed a little bit, and President Obama said, I don't know if y'all have seen this, but on 3 different occasions he said that we should consider putting tort reform in this legislation, and it's not in there yet. I don't know about the House bill. I can't speak to that, but I know it's not in the Senate bill, the health bill yet. And I don't know if it's going to be in the Finance Committee bill. The cost is a major concern. There are so many problems with the healthcare system we have today. I think I'd put it like this. I'd say that we do some things in this country when it comes to healthcare very, very well. And some of those are, we do a very good job of fixing people when they're sick, or they have some sort of chronic condition or whatever the case may be. I think that's why you see people come from around the world to come to the U.S. for treatment. Where we don't do a great job, and where our system isn't really set up to do this, is on the preventive side and try to promote a healthy lifestyle and a lot of these things. This has been a great process for us to go through because, for example, we had Safeway in the other day. When I say we, I mean it was all the Democratic senators. They had the Safeway CEO, and Safeway redid their healthcare about 3 years ago. They just kind of gave it a scrub, and from the ground up just took a totally different approach on the healthcare. One of the things they have done is they have built in a lot of incentives into their healthcare system and their healthcare policy. So, for example, if you're a smoker, if you want to stop, they will pay for smoking cessation, and there are some other companies that do that, but where they have an advantage is if you actually quit smoking, go through the system, quit smoking, and somehow or another a doctor can tell after a year you quit, it'll actually give you a rebate back on your premium because you quit smoking. They also have a thing that you go in, and I'm assuming how it works is you go in and do a body mass index. I guess that's what they do. And they give you targets on your weight to hit. And as you hit those targets, they actually lower your insurance premium rate. You know, it's things like this that incentivize people. What's happened at Safeway in the last 3 years, they have actually capped their expenses on healthcare been level. Their healthcare has not gone up in 3 years, and they have a healthier population that works for them now. I mean, you can measure it. And so it's been good to look at some of the success stories out there. And, you know, you touched on 3 things I think we should definitely consider putting in the legislation. Like I said, not all 3 are in there yet, but we're still kind of midway through this process, so you may see those go in. Yes, sir.
It seems to me that tort reform has got to be coupled with malpractice issues that are not being properly dealt with at this point. If you can deal with those, then tort reform makes sense.
When you say malpractice issues, you mean how?
Well, there's the enforcement of malpractice issues as far as removing licenses from doctors who shouldn't be practicing or have been committing a great deal of malpractice. That's not being dealt with properly. And it's on a state level, unfortunately, not a national level.
Right.
And if you're going to do national tort reform, you've got to do national malpractice issues as well.
Yeah. Well, like I said, that piece has not been put together yet, and I will say this, as a general rule, to answer your question too, as a general rule, medical malpractice has been a state issue, not a federal issue. There are a lot of people who don't want to federalize it. They want to leave it a state issue and let states figure it out. And also, a lot of this insurance reform that you're talking about also has been reserved for the states as well. So you have a little bit of a federalism question about whether the Congress and the White House should be doing these things or should leave it to the states. But we're gonna work through the whole tort reform question. I don't know how it comes out yet. Right now. I don't even know, what's going to be offered. But something like you're saying is very possible will be offered, and we'll work through it and see how it works. Yes.